Hello, everyone. My name is Ufoma Oyibororo, and here at the School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Strength-Based Approaches to Adolescent Sexual Health and Being an Askable Adult. During today's presentation, attendees will learn about strength-based approaches to sexual health counseling and services. Today's presentation will also help participants identify strategies of being an askable adult to help empower youth and help them feel comfortable asking for your support. Before we begin, if you are viewing as a group, please open the chat window by clicking on the chat tool and type in the name of the person registered for this webinar and the total number of additional people in the room. This will help us with our final attendance count. The School-Based Health Alliance is the national school-based healthcare advocacy, technical assistance, and training organization based in Washington, D.C. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. As youth-friendly and accessible settings, school-based health centers are uniquely positioned to deliver high-quality, confidential services that equip children and adolescents with the information, tools, and support they need to be healthy and safe where they are when they need it in school. We believe that all children and adolescents deserve to thrive. When health and education come together, great things happen. Now we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during this webinar, please use the chat tool located in your Zoom control bar. We will address questions following the presentation. Also, at the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in crafting presentations that meet your needs. This webinar is being recorded and will be archived on our website in 1 to 3 business days. Please also visit the School-Based Health Alliance website for additional archived webinars for topics such as the ones you are viewing on your screen. Now, I would like to introduce our presenter for today. We will be hearing from Lauren Leslie, a program coordinator with the Adolescent Health Initiative in Ann Arbor, Michigan. Lauren?
Hi, everybody. Thank you so much for joining the Adolescent Health Initiative and the School-Based Health Alliance here today to talk about strength-based approaches to adolescent sexual health and being an askable adult. The Adolescent Health Initiative is based out of the University of Michigan, but we provide technical assistance, training, consulting, and resource development to healthcare providers, health systems, and youth-serving organizations all across the country. Our vision is to transform the healthcare landscape to optimize adolescent health and well-being across the country. So I have a few objectives for our presentation today, but before we jump into those objectives, I want you to go into that chat that we have that everybody's putting their names in and say where you're coming from. What are the roles that you have? What is your profession? What do you do for me to get a sense of who we have in this presentation, but for everybody else to kind of see where all the different people are coming from and all the different disciplines that are coming together to talk about strengths-based approaches. I'm seeing some messages that it's kind of spotty. The audio is a little bit spotty. Hopefully, and it's staticky. Well, hopefully some people out here can hear. Still a little bit bad. All right, pause just for a second while I get this volume a little bit better. Okay, maybe it's a little bit better now. All right. Okay, so I see we have some RNs in the presentation. We have people coming from different health departments, program coordinators. Very cool. I know that the Adolescent Health Initiative is a multidisciplinary organization that has medical directors. We have health education professionals, social workers, and we all come from these, come from a different perspective, and are all coming here for helping adolescents and supporting adolescents, especially when it comes to strengths-based approaches and sexual health. So today we're going to be talking about what it means to approach adolescent sexuality from a strengths-based approach. And through that, learning what it means to be an askable adult when working with, communicating with, and supporting adolescents. We will learn strategies for getting comfortable with talking to adolescents and being someone young people trust and feel comfortable talking to. We'll also explore the concepts of sex positivity and how they can be applied when addressing adolescent sexuality and adopting a sex positive or sex affirming approach to providing health services to adolescents. So whether you're coming to this presentation as a seasoned sexual health professional, provider who works with young people every day, or even a parent of teens or soon to be teens, strengthening the way that we talk to young people about sex and frame healthy sexuality for yourself and your profession can help to foster positive, youth-centered, and empowered healthcare for all adolescents. I love to see where everybody's coming from, all over the country. Louisiana, Pennsylvania, very cool. Okay. We're going to take a second to think back to when you were a teenager and you needed support from an adult. Who did you feel comfortable talking to? What was it about that person that made you feel comfortable? Did they seem like someone was approachable, that they were just an easy person to talk to? Was it that you felt like they knew a lot? They knew a lot and you could ask them any question and that was somebody that you could go to? Or was it that they were just an overall warm and pleasant person to talk to? I think we can all kind of identify somebody in our lives who, you know, it was somebody that we could talk to, that we could ask questions for. Now I'm gonna recheck my audio again, getting some messages about it, and I'm gonna maybe grab some headphones or something to make this better, or call in. Just one second, thanks.
Hi, everyone. This is Ufoma from the School-Based Health Alliance. We're currently working on the audio issue, so please bear with us for a moment.
All right, I am back. Can everybody hear me? I'm on my phone now. Hopefully this works better. Okay, yes, 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 awesome. All right, thank you so much. Sorry about that. All right, so we're reflecting on people that we thought were easy to talk to when we were younger, people who we could talk to that we felt comfortable around. So I think that that's like a good reference point to going into what it means to be an Askable adult. So considering those in your life that you knew you could go to for support, how can we as adults who care for the health and well-being of adolescents make space for young people to open up and talk about their sexual health? Well, what we can do is we can work on being Askable adults. So what are a couple of ways that we can do that? To start off, we can convey warmth through body language and use a non-judgmental tone of voice. So having that warmth in a person to know that you can go to them and they're just going to be easy to talk to. Next is to ask open-ended questions and practice active and reflective listening. This means that you're paying close attention to what somebody says, including their tone of voice and their body language, as well as repeating back what they say to ensure that you understood them correctly and that they know that you're listening and engaged. To be Askable, it's also important to avoid making assumptions. And this is something that we'll talk about a lot through being strengths-based. To being an Askable adult is just not making assumptions about what the young person is coming to you for. So open up your dialogue with questions. Encourage adolescents to guide the conversations around their own personal health while honoring their autonomy and their identity all around their own personal choices around their health decision-making. To be Askable, one might also give affirmations and avoid criticizing or shaming young people. For those of us who are familiar with motivational interviewing techniques, affirming patients' effort and strengths, in this case adolescents, is pretty much key to encouraging dialogue and building confidence of the young person in their health decision-making, but also encouraging that dialogue and confidence in the relationship between the provider and the young person, so having, trust between the two. Askable adults keep conversations focused on the adolescent. So they're providing clear information and kind of trying to avoid giving opinions or personal experiences, moving away from personal stories and putting all of that focus on the experience of the adolescent. Finally, another point to mention is that being an Askable adult means that you discuss confidentiality so that the young person that you're speaking with knows what kind of information will and will not be kept private in your interactions. So when an adolescent is provided with confidentiality to the best of the provider's ability or to whoever the young person is speaking with, or at least have conversations around confidentiality, the young person's access and the quality of their healthcare increases. It might help them be more likely to disclose health behaviors that if they weren't assured of confidentiality or hadn't had discussions around confidentiality, they might not otherwise be comfortable sharing. So naming some of those traits of being an Askable adult might be sparking in your head some ideas around what you do when you personally talk to the young people of your life, whether that be in your profession or in your everyday life, how maybe some of these strategies can be applicable to how you engage with the youth and maybe possible ways for you to improve or to incorporate that into your practice. Being an Askable adult is an important element in creating safe spaces for discussions for adolescents and their health. We're going to go into this next section, and it's going to consider and have you consider what it means to be an Askable adult as we explore concepts of sex positivity and how that can be applied when we're addressing and talking about and having discussions around adolescent sexuality. So we know that it can be difficult to initiate and sustain supportive and empowering discussions around sex and sexuality with young people. It can be kind of hard sometimes, but it's important. It's important to learn new skills so that you can improve your confidence around your ability to open up about all types of conversations and topics around sex with young people that they might bring up. So all of the work that we do with AHI, and I know a lot of people, it looks like out there, work with adolescents on a daily basis. You center the young people in your life to create the best healthcare, to create the best support services that you can for these young people. And it's always important to check in on their points of view. So what are they feeling? What are they saying? I have a clip of a young person talking about their experiences, and we'll listen in.
For me, I remember one of the first times I talked to my mom about birth control. For me, I remember one of the first times I talked to my mom about birth control was I had like I don't know, I had gotten caught doing something like bad. I don't remember what it was. It was like maybe I like snuck out or something. I don't remember what it was. But and I remember she was like really disappointed in me. She was angry and she like said like, oh, now do we need to put you on birth control too? And like that's something that like sticks with me, like has stuck with me since she said that. Like our relationship has come a long way from that. Like I was able to like I have like the birth control implant and like now we have a more open conversation between us about it. But that was my first kind of conversation with her about birth control, and that really like made every conversation uncomfortable from that point on. And then with providers, I think it's similar to like I felt like I had to like when they're like, are you sexually active? It's like, yeah, and they're like, okay, how many partners do you think you've had? And I always feel the need to like really like lower it than what it actually is, just because based on the way that they talk about it and the way they're obviously uncomfortable, just makes me uncomfortable, you know?
All right, at the outset, it can be helpful to consider all these types of messages that we're receiving, implicit, explicit messages that we've received around sex and sexuality in our lifetime, and how socialization has shaped that for all of us. It could possibly be that through all of your experiences, you haven't really been given a message, but no message is still a message, especially when it comes to these complex, often contradictory social norms, conversations, dialogues around sexuality. Many of you might have heard don't or no at every turn in all of your experiences, just a lot of no's, but without any direction or what goals that you could strive towards or support systems around that, just a lot of no's. It might make you think, how do these influences and experiences and things that we've gone through shaped our own personal views on adolescency? Your views can definitely vary, and they're impacted by a whole bunch of different things. They can be different based on your gender, your race and ethnicity. It could be shaped possibly by your religious background, your family structures, and the ways that you interacted with your family. It is definitely influenced by all the types of media that you've consumed throughout your life, and especially the media that you had growing up and what you absorbed from that. And then it's also influenced by your own personal experiences around sex and sexuality. These are all things that that you bring when you talk to young people about sex. They are something that you have to identify are things that you've experienced and relate to the messaging that you give out when you talk to the young people in your life. So now thinking about these messages that you would want to ideally convey to the young people that you work with, think about how you have the opportunity to shape these messages around sex and sexuality to the adolescents in your life, be that the patients that you work with or the young people that you teach, or even the people in your family, the young people that you talk to every day. So this next slide that we're going to look at, we'll be taking a look at some of the topics that might come up in the context of a visit or with a conversation with an adolescent. I want to acknowledge that some of us might not be at this moment willing or able to talk about some of these topics for a lot of different reasons, but just wanting to name that they have the potential for showing up in discussions around adolescent sexual health. They might be things that young people talk about and they have questions about. So I'm going to take a look at that. I'm going to throw a few topics around sex up there for you to see. And imagine that you're working with a younger adolescent and they're asking you about a topic like the HPV vaccine. Think about where you'd place your level of comfort within the circle. So do you feel really confident in your ability to talk about the HPV vaccine, or is it just something that you're not willing or not able to discuss? Maybe it's difficult for you to talk about, you don't have enough information. So kind of imagine this, these different layers of comfortability in talking about different topics. There's no right or wrong answer. This is just definitely for your own personal reflection. And we want you to be honest with yourself about what might make talking about a number of these hard. And on the next slide, we're going to talk about maybe a couple more topics that will have the possibility of coming up in conversation with young people, and think back to this circle to see and gauge your comfortability with talking about these different, different topics of conversation around sex. As you look at this list, read it through, consider that many young people have a lot of knowledge around these topics. They have experience with these topics. They have lots of questions, maybe they have concerns. They might not have somebody to talk to, and they're coming to you for answering their questions or just being open about their experiences and the things that they hear about, the media that they consume, the influences that they have from their friends. And these all have the possibility of coming up in conversation. And just kind of another reflective process is to think about your first feeling that you have when you read these. So what are your associations with any of these? Do you think about health outcomes, possible related negative health outcomes, or do you have negative associations with any of these? And consider the messaging that you've possibly received throughout your life around some of these topics. Could these be perspectives and experiences and messaging that you have be contradictory to maybe what you would share with a young person? So would it be what you share with the adolescent patients that you see every day be different, giving them different advice or talking to them about these different topics than maybe what you've personally experienced? We're not going to pause to really consider every single one of these topics, but on your own time, kind of think about, if there was a possibility of these topics coming up, what intentional messaging would you want to send around these? Specifically to the young people that you serve that might come to you with questions or just wanting to have a conversation. What is it that you would want to communicate around health, around behavior, around, just being able to be open and talk about these topics that come up with sex, especially with young people. And ultimately, coming back to, why we do what we do we want our adolescent patients and the young people that come to us every day to feel like they can come to us with any questions that they have, and anything in their sexual health, all aspects? Is that, a goal that we want to work towards, to have young people feel comfortable in talking about what they're going through. I think that we are all too familiar with these patterns of adolescent sexuality and kind of the traditional way that sexuality has been talked about, that we hear messages around it being morally wrong. So young people engaging in sex is inherently deviant, or that talking about sex and sexuality with a young person is a taboo topic, that it's bad, we shouldn't talk about it, kind of messages that maybe we're familiar with or like hear around in talking about sex in relation to negative psychological and physical consequences. And then, this broad overarching element that we talk about where abstinence in adolescence is the healthiest behavioral outcome. And that is the sole message that we're giving to young people, that is, it is, as they talk about, like the only option is, these are messages that we hear and we're pretty familiar with in these traditional, teachings around adolescent sexuality. While there's movement towards comprehensive sex ed that considers both the emotional, the intellectual, the social aspects around sexuality, much of what's taught and promoted in sex ed programs are fundamentally around abstinence from sexual activity. So that's abstinence until marriage as the healthiest behavioral choice for adolescents. This way of teaching emphasizes a risk reduction as the central framework. So it's taught through lessons that highlight the physical and psychological harms of engaging in sex outside of specifically mutually monogamous, committed, usually until marriage, heterosexual relationships. So that's kind of the typical framework that we work through, or that we hear, or that we're pretty familiar with. we might have experienced or be familiar with shame-based approaches and teaching around sex and sexuality. So that's, for example, like showing graphic slides and photos of STIs, using metaphors around sex that might contribute to deepening, shame or stigma against sex in general. And again, kind of like what we talked about earlier, a lot is said when questions are avoided or topics of conversation are dodged, because that can deepen the feelings of shame in young people who are being brave and they're asking questions and they're talking about their experiences. And then when those questions are ignored, it might drive them away from being confident and asking those questions that they have about the things that they experience. The language that we hear and the language that we use also works in covert ways to imply inherent risk in sexual activity. So just generally associating risk with all sexual activity. And an example of this is when we talk about lumping together drug use, interpersonal violence, sexual activity, and risky behaviors. What we really mean is to refer to activities that may have risk for adverse health outcomes or, have some risk associated with them, but they require consideration for other co-varying health conditions, talking about other health behaviors, and may be a little bit more important to approach these situations from an individual patient-centered approach and identifying risk and approaches for, talking to those young people instead of just applying risk to a broad spectrum of behaviors, especially with adolescents. Supporters of a sex-positive perspective don't seek to trivialize or completely throw out these risk management aspects of sexuality. So I know that that's what a lot of people do, what a lot of people in public health do, and probably out there are working on addressing, these risk managements of sexuality, because there are associated risks. But preventing these adverse health outcomes is definitely an integral part of sexual health and a critical piece of what I'm pretty sure most of you are doing out in your work to promote the health and well-being of adolescents. Oops, sorry about that. There are a lot of ways that sex positivity or strengths-based approaches to adolescent sexual health can take shape. It is a way to promote the idea that consensual sex between teenagers is potentially a positive and a healthy thing. It's a way to approach sexuality from an inclusive lens. So that's inclusive of all different types of sexual behaviors, all different types of sexual and gender identities too. So, really highlighting the diversity in sex. And then also recognizing that abstinence definitely is one healthy choice that an adolescent can make, but is certainly not the only healthy choice. So while we're talking about sex positivity, I just wanted to name the importance of understanding asexuality, which is kind of a commonly misunderstood orientation. Asexuality is different from celibacy, which is a choice to abstain from sex. But this is someone who does not experience sexual attraction, and they don't have generally an intrinsic desire to have sex, or they actively choose to just not have sex. So folks who identify in this way, or they experience this lack of sexual attraction, they might also still have romantic, they might have aesthetic or sensual attraction. So there's a lot of levels and layers to that. But I wanted to make sure to hit home that while we're promoting the idea that consensual sex between adolescents can be a potentially positive and healthy thing, we want young people to know that if they aren't engaging in sex, that they're still receiving the same messages of empowerment around their choices, that we're supporting their positive health and development, and that they consistently have affirmation for their sexual health and their sexual health choices and, how they identify or with engaging in sex or not. So just wanted to make a little note about that. It's important to think about. So we've talked about the foundations, some of the foundations of sex positivity and how to be an askable adult for adolescents. So how can healthcare professionals be sex positive? It's definitely possible, even in those situations where you only have a couple minutes to spend with a young person, or you only see them for one time, or you have months that go between seeing these young people. And I know that that's a really common thing in the healthcare field, that you don't have as much say with talking to young people, but it is definitely possible to infuse a lot of these strategies and practices into those 2-minute visits or those consistently weekly visits that you have with young people. Amy Shelley, she's a sociologist who grew up in the Netherlands. She moved to the US. She does a lot of writing on reflecting on the differences in culture and sex, has come up with this framework for healthy teen sexuality. And it's a quick reference guide for how you as a practitioner or you as somebody who works with young people can center your mindset around positive adolescent sexuality and promote health and well-being when working with young people. So the first one that she looks at, the A, autonomy, and this is around helping people develop self-awareness. So helping young people develop the ability to figure out how they really feel in relation to sex and sexuality, helping them identify that within themselves. Second, she looks at building positive relationships. So when working with young people, we're applying language around promoting trust, equality, communication, setting healthy boundaries, and then establishing respect in relationships. Similar to that, she touches on the idea of connectedness. So encouraging making connections with people that you feel safe around or young people feel safe around, and engaging in this connectedness in places that make you safe, that are supportive spaces, that are surrounded by parents, other friends, other adults, people that young people are having relationships with. So promoting these healthy, connected relationships is a very important message that we can share with young people. The next point that she touches on is diversity. So you yourself as a health professional, it's very important. It's critical to respect different sexual orientations, to respect different gender identities, a young person's pace of development, how their cultural values and personal values influence the behaviors and choices that they make around sex. And then similar to that, it's a really good responsibility of professionals and people who work with young people to continue educating yourself on these different aspects and infusing them into your practice, and kind of identifying how you can strengthen your ability to communicate these different ideas with young people, and helping create a space of understanding and acceptance of all identities. And this is something that's always changing, and we're learning new information, and we're listening to young people and how they're identifying. So keeping up to date, and just knowing that you are in a place where you can talk to a young person regardless of their identity, and you can share and celebrate the identities that they bring into your practice. The last point that she makes is addressing disparities. So we talk a lot about this in sexual health, that problems that come up in sex and sexuality can correlate with possibly a lack of resources, with a lack of education, and maybe lack of access to healthcare or experience with having positive healthcare experiences. You as somebody who works with young people, being aware of these relationships between social determinants of health and a young person's sexual well-being. This includes having the ability to have these conversations with a young person and talk about more than just the medical aspects of approaching sex and sexuality, but considering all of the social aspects that relate to what a young person is engaging in, and what their conversations sound like, and what their relationships look like. So being able to identify those and have conversations with young people is a very important part of that framework. As we move into what this looks like in practice, here are a few strategies to keep in mind, again, when we're assessing when and how to utilize a strengths-based, sex-positive approach when we're working with adolescents. The first thing that we can do is avoid moralistic value statements. So avoid ascribing negativity or positivity to the variety of sexual behaviors or identities. We can, again, promote diversity and promote the wide diversity that exists in sexualities. So the diversity in identity and orientations and personal preference of all of the identities that are coming to you and young people are sharing with you. The third would be to support the autonomy or the ability of a young person to make their own personal choices. This is a unique time in adolescent development that they are really needing support to grow as a person and grow in their ability to make their own personal choices and decisions. And you as a provider can really create those spaces where a young person feels like, yes, they have the ability to make those choices for themselves, and they do know a lot, and they have the ability to ask questions, and they have that, empowerment to take charge of their health. We can also contribute to reducing stigma around sexual choices. So again, as a person working with young people, this can be done by answering questions with facts instead of maybe using personal anecdotes or stories. We can look at the research and talk them through, what are the facts? What does this mean for you? And then also being aware of your personal attitudes, the things that you bring to the table, your biases possibly, and then addressing any body language or the language that you use with a young person. You can try to break down those barriers and break down the stigma when you're talking about different topics around sex with a young person. Next, we can, in being a sex-positive person and provider, we can, really share that sexuality is developmentally normal. And particularly in adolescence, this is a time where a lot of what they're talking about and what they're doing is normal. There's a lot of research I am sure everybody is familiar with to, hit home and to talk about why this is like a normal thing that young people are going through. And those are conversations that we can have with the young people that we work with, that this is a normal thing that we all go through, and, talk them through it from that perspective. The last thing, and definitely this is not a limited list of ways that we can be sex positive, but is, kind of the main pillars of sex positivity is utilizing a motivational interviewing approach. So what this looks like kind of essentially around motivational interviewing is expressing empathy when you're talking with a young person. So being empathetic to what they're talking about, and then also giving affirmations for their effort, for the things that they're going through, for being somebody, for talking about what they're going through, and coming to you for conversation. It can also be around identifying goals and relating them to maybe current behaviors or things that they're going through. Goal setting and finding that connection between future goals for health and well-being, and then also relating that back to behaviors and practices that they're doing today. And then also along the lines of motivational interviewing techniques is supporting a young person's self-efficacy, or really encouraging them to believe in their own ability to make positive change, have positive behaviors around sex and sexuality. And this is, I think motivational interviewing is a growing field, particularly around sex and sexuality, working with adolescents. And I have a couple of resources that I can send out. I see in the chat about some research around this motivational interviewing that I can send out in our follow-up email. So it's really like a growing field, and anybody who's interested in influencing the field of MI with sex positivity it can't be a bad thing. So I will throw that in there for all of you. Thanks. So as adolescent health professionals, we might personally be more inclined to feel more comfortable talking about sex and taking a more sex positive approach, but want to try to talk about how that might not be the case for everybody in a clinic. Might be a little bit look different for other providers or for other staff within our practice. In the work that our organization does, that AHI does with physicians and health clinics around the country, is that we've heard from pediatricians, family medicine, family planning clinics that there's a sentiment of maybe higher confidence around providers on their ability to talk about these things, but maybe not so much on the end of MAs or front desk or call center staff to use these strengths-based approaches, or maybe it's just not something that is taught clinic-wide when we're discussing adolescents and their sexual health. But even though they play different roles in the clinic than maybe a provider, their role is incredibly valuable, and they do interact with the young people, and that their visit to the health center and their overall feelings towards taking charge of their healthcare decisions can definitely be influenced by their interactions with everybody in the clinic, even outside of their provider. So take a second to read this scenario below. Just two different, ways of communicating around using condoms. Definitely something that we talk a lot about with sex and young people. And it might be easier to understand why the provider on the left side, in the first situation, why they said what they said. Their intent might come from a place of concern. However, most people, including teens, they might already be aware of the risks that are associated with not using a condom. The second approach focuses on what teens are doing well. So that's a strengths-based approach, not focusing on the negative or sounding critical. So taking what you've heard so far, you might be able to see how affirmations, open-ended dialogue that you see in this second approach might be more effective in helping the teen consider choosing or moving towards health-promoting behaviors, like using a condom consistently. We're going to look at two scenarios. So imagine that a medical assistant in your clinic needs to collect a urine sample for a routine chlamydia screening. And the MA says in a hushed voice that it's for chlamydia screening. Don't worry, as long as you're not promiscuous, you should be fine. Take a minute to look at that statement. And we have the chat up, and I think we might be like thinking about what a young person would feel if they were hearing that, if they were in the clinic. If you want to chat in, what could the possible impact of the statement be on an adolescent coming in, maybe for just a routine visit, and they're doing their routine chlamydia screening? How could that impact an adolescent patient? Shame-based, it could definitely make a young person feel ashamed for even coming in or talking about their sexuality or just their general sexual health in general. They might be feeling judged or shut down. Yeah, definitely. That it's just wrong. Accusatory. Yes, I know. This is kind of a jarring statement that might make a young person just feel like they can't find trusted adults, that they wouldn't trust an adult to make a statement like this, that it questions their choices around maybe their sexuality, having negative, guilty associations around sex. Demeaning definitely could possibly make them feel embarrassed or shamed. Yes, definitely not a positive, strengths-based way to address talking about taking a urine sample for a chlamydia screening. Here are a couple of maybe alternatives that are more strengths-based that the MA could talk about when bringing up that chlamydia screening. So just generally being like, we do this for everybody, that this is, a routine practice, nothing more, nothing less, that we just do this for everybody. And then also saying, you could say that it's a simple test, and a simple test that gives you really helpful information about your health. The fact, we're here for your health. We want to just give you this test because it's routine. We do it for everybody. So just validating that this is normal, no moralistic associations, nothing that jumps out as, that could make a young person feel ashamed for even being there in the first place. We have a second situation. This is a provider, and the provider is working with CJ. CJ came in today because she wants her IUD removed. And the provider says, only 17. I can see how hard it is for you to take care of the baby that you already have. We just put your IUD in a few months ago, and it sounds like you don't mind the side effects. Why would you want to have it removed? And again, in the chat, if you want to feel free to chat that in of picking what we've learned so far about being strengths-based and strategies that we can do. How could the provider have reworded this? You know, CJ came in today, she wants her IUD taken out, and it appears like the provider's jumping to a lot of conclusions, making a lot of assumptions about her coming in there for getting her IUD removed. So maybe how could this have been said in a better way or a more strengths-based way? You could consider, when thinking about maybe how you would word this differently, acknowledging that she might not feel comfortable, reflecting that from CJ that she was in here for a specific reason. She wasn't feeling comfortable with this IUD that she has. So affirming that that is something that she's not comfortable with. You could also, obviously consider moving away from those moralistic statements, associating those positive and negative assumptions of what CJ is going through. You could, along the lines of giving, the facts and the science, you can mention other methods of birth control. Talk CJ through what she's going through, what her side effects are, or why she doesn't like it, and promote other choices of birth control that might work better for her. And those move away from those assumptions or associations, and just having a conversation around her health. And you as a provider have this ability to ask those questions and have the ability to break down barrier to understanding, ultimately to support CJ's choice in her contraceptive methods. So here's a couple of suggestions. Well, it's helpful for the provider to learn more about CJ's reasons for wanting to have her IUD removed. She could be, or the provider could be more neutral in saying something like, if you're comfortable, could you tell me more about why you want your IUD removed? Focusing on a young person's personal perspectives can help show respect. It can help validate their feelings and their experiences. And it can also allow the provider to help the patient clarify any concerns that come up and ultimately identify a solution that would be realistic and hopefully more healthy and work better for what CJ wants. So we've talked about strengths-based, patient-centered, sex-positive approaches based on the assumption that young people deserve accurate information, and they also should be honored with respectful treatment related to their sexual health. What can each of us in our different roles do to promote a strengths-based approach to adolescent sexual health? And I know we're having amazing conversation in this chat, so many good suggestions and back and forth about how us from our different perspectives can be approaching the conversations we have with young people in a more strengths-based way. So if you feel like typing in some of the things that that you could personally bring back to your organization, or things that you're currently doing, or things that maybe you could have more conversations with the people that you work with, feel free to type that in there. I know that there are so many things that we can go back and, share the strategies with our coworkers, and not just the physicians. It's all the people who are working in the clinic, working with your coworkers, the other health behavioralists that you work with, the other teachers that you work with, how you can infuse the strategies and language around being strength-based, both in adolescent sexual health, but also just adolescence in general, how to be an askable adult and be a person that a young person can talk to and feel comfortable around. There were a couple that I saw a little further up around, like you could practice these every day, a little bit at a time. So something like reflective listening in any situation works really well. Reflecting back the conversations that you're having to acknowledge that you're engaging, you're listening, and that person feels like the conversation is valued and being understood. talk to colleagues that organize reproductive health workshops to include strengths-based approaches for MI training for providers, definitely. You know, adding more trainings and more things that relate to the things that you do every day to grow in your ability to talk to adolescents and to always be improving, I think is really awesome. Staying up to date with best practices for adolescents and adolescent sexual health, and promoting sex positivity. Well, yes, there's a lot of good conversation. So check in with your colleagues in the chat to see that there's a lot of good work being done already, and that there's a lot of opportunity for growth, especially in school-based settings or you know, health, specifically health centers in schools to work with nurses and teachers. Yeah, there's a lot of good stuff in here. So take a look, and you can get good ideas of what people across different disciplines are doing. I hope that you were able to take away today some of the unique strategies for getting more comfortable with talking to young people and being a person that adolescents can feel more comfortable talking to. Similarly, how you yourself can infuse a sex-positive perspective into your organization's work and with young people, and applying a general sex-affirming approach to providing health services for adolescents. We're going to leave with a last young person perspective, always beginning and ending with, you know, the voices of the young people, because that's why we do what we do, because we care about, you know, what they think and what they talk about and, you know, what they're going through. So we will listen in on that.
There's a young woman like today, like right now, it's like there's already so many, like, we get so many different, like, judgmental messages about sex, whether it's slut shaming or like you're a prude, and it's important that your doctor's office is a safe space where you don't have to worry about like any of those preconceived notions that you're fed all the time, and just a space where you can, I mean, it's a space where you're supposed to learn and like be able to talk about the things that you're going through.
One more thing, I will also say a lot of us don't know about the topic of sex positivity, and we don't know that such a campaign is existing, and people are like, we don't know. So the stigmas around it, like we're trained to believe them too, and so that might make us more uncomfortable as well. Mm-hmm. And so I don't know how I'm trying to word this, y'all. We're trained to believe the stigmas too, and when it comes to sex positivity, even though we might not know about it, we want to have the conversation and we want to engage in that type of dialogue with you as a healthcare provider. As a healthcare provider, it's your job to set the tone and create the space for us to have the conversation about sex positivity, because we're all learning. There. Ooh, ooh. Yeah. Look, at this point, I stopped thinking for myself.
All right. AHI, the Adolescent Health Initiative, wants to support you in your growth in being more strengths-based and promoting sex-positive approaches to adolescent health, and just promoting adolescent health and well-being across the board. And we do, like I said before, consulting, technical assistance. We have so many youth-driven videos and starter guides and Spark trainings that you can use within your clinic for all of the people who you work with, from providers all across the board. We have webinars, trainings, and a lot of materials that we want to support you with, and a lot of them are free. They're on our website. Our Spark trainings, like I mentioned, can be used to share ideas and to create conversations and cultivate new learning opportunities for people clinic-wide, organization-wide. They're not all specific to medical healthcare. They can be conversation starters for a whole bunch of different disciplines around nonverbal communication bias. We have a 4-part series on LGBTQ youth, cultural responsiveness, and one specifically on identifying and supporting trafficked youth. And like I said, we connect with young people all of the time consistently with our Youth Advisory Council. And we have these amazing posters that were created by and for them. So taking charge of a young person's health. And these are materials that can be put up to make a young person feel welcomed the second that they walk in. Posters that they know that they can take charge of their health, that they are welcomed in this space. We also have one on confidentiality, which is really cool. And then if you want to make your organizations more youth-driven, which is a definite thing that everybody can do. We can incorporate youth voices into a lot of what we do. We have a guide on how to develop your own youth advisory council and how to support thriving advisory councils of young people to, help support your organization and for you to support them ultimately. Thank you so much. Thank you for joining in today. I think that we have some time for questions. If I believe time allows, if anybody has any questions to jump in the chat. I am here for a couple more minutes. I saw that we had some questions pop up earlier in the chat. Yes, definitely gonna send out some references to motivational interviewing and how that can be incorporated into what we do.
Thank you, Lauren. Now is the time, like Lauren said, to enter your questions into the chat box in the Zoom control window. And while you are entering your questions, we have a few announcements we would like to share with you. Please join us and become a member. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based healthcare. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after this presentation to visit www.sbh4, that is the number 4, all.org/membership for more information and to join. The 2020 National School-Based Healthcare Convention will be held June 23rd through the 25th at the Sheraton Denver downtown in Denver, Colorado. Join the School-Based Health Alliance, the Colorado Association for School-Based Healthcare, and your peers from around the nation for 3 days of engaging workshops, networking, and fun. The theme for the meeting is School-Based Healthcare, Elevating a School Climate of Health and Safety. As the premier national gathering for our field, the convention is a fantastic opportunity to connect with hundreds of fellow school-based healthcare professionals and advocates from across the nation. Registration is now open, and we hope to see you there. Also taking place at the convention is the Be the Change Youth Training Program. Be the Change is an opportunity for youth aged 14 through 18 to connect with like-minded peers from around the nation who are passionate leaders of change in their schools and communities. Through exploration of health and education topics, advocacy and leadership skills development, and networking with each other and school-based healthcare advocates. Be the Change gives young people a platform to expand their knowledge and confidence as directors of their own health and champions of youth voices. There are scholarships available to assist youth with hotel accommodations, and for the first 25 youth applications, they will receive a discounted registration. Please visit our website for more information on the Be the Change Youth Training Program.
Thank you so much. I see a couple of good questions. I know there's one that a lot of people are mentioning, and that is around resources specifically for considerations for young people with disabilities and engaging them in healthy conversations around sexuality. AHI has a number of resources on our website that talk about youth with special health care needs and how we can create conversations that are inclusive and engaging and evidence-based that can help us work best with adolescents regardless of their identity, but also honoring the things that they go through and who they are, and making sure that their health is the best quality for them. So you can take a look at that under our Improving Care on our website. There's some good resources on there that might be helpful for that. And yes, the slides in the presentation will be available, as well as a recording of the presentation.
Thank you again, Lauren. Thank you again,
Thank you so much.
Thank you again for attending our webinar, and we hope you have a wonderful day.